Hello everyone, I'm Don Deep, and I'm so excited and quite humbled to talk to you today as the next CEO of COPC. I want to thank Dr. Wolf, Dr. Pugh, and the COPC Board of Directors for their time and diligence throughout the entire search process. I'm honored they have chosen me to help lead our amazing company into the future. Together, COPC's 500 physicians and 2,200 associates have established a one-of-a-kind healthcare company. We have become a national leader in providing high-quality, value-based, and patient-centered care to more than 500,000 patients in Central Ohio. These patients trust all of us with their health care, and that trust is something I know we all take seriously every day. Many of you know me, but for those that don't, I grew up in Pittsburgh. I went to medical school at Northeast Ohio College of Medicine. While in my first year of med school, I met my wife Nina during our first class together. This was 1990. Seems hard to believe it's been 32 years. We came down to Columbus after med school, and in 1997 I completed my internal medicine residency at Riverside Methodist Hospital. Immediately thereafter I joined COPC. I worked in the COPC hospitalist practice for 20 years, seeing COPC patients at many hospitals around Columbus and watching COPC grow from just 40 physicians to nearly 500. I moved into a formal medical director role with COPC around 2017 and moved up to the central business office shortly after. For the past several years, I've continued to work with the hospitalist team, along with the same-day centers, our comprehensive home and palliative care program, and other COPC initiatives. During COVID, I worked closely on all our vaccine clinic rollouts. I've had the pleasure of serving on the COPC Board of Directors for many years. From 2014 to 2017, I served as the president of the medical staff at Riverside Hospital. I consider myself very much a relationship-based leader, and I've had the pleasure of forming great relationships with many of the people in COPC over the last 25 years. Before Dr. Wolf officially retires at the end of the year, I look forward to working very closely with him, Mike Ashinen, Dr. Blosser, and the entire administrative team as I onboard into this role. COPC has had some impressive growth over the past decade. We're in 6 counties now with greater than 80 sites and multiple service lines and departments. While others in healthcare are still figuring out whether they should move from volume to value, we've already shifted a lot of our focus to value-based care. This is not only a way to ensure we take the best clinical care of our patients, but we also accept our responsibility for the financial impact healthcare costs can have on patients and families. Embracing value-based care throughout the organization also helps ensure COPC's own financial well-being now and into the future. Proving our success as high-quality, low-cost healthcare providers will continue to make COPC the #1 choice in primary care. But as amazing a company as we are, we know we have significant challenges now and in the years to come. We are coming out of arguably the toughest 2-year stretch in generations. And while the acuity of COVID illnesses has subsided, the continued effects of years of isolation and lives being turned upside down are present daily. As well, we know we have workforce challenges ranging from burnout at every level of almost every organization, with healthcare providers among the most affected, to the paucity in numbers of people in the workforce that present constant staffing challenges for many of our offices. And while COPC certainly delivers excellent care throughout all of our service lines and sites, we always need to be striving to improve and make sure we keep the patient at the center of what we do and the decisions we make as an organization. We must remember our promise to be the best for our patients and the best for each other. Delivering high-quality healthcare is hard. Heck, life is hard. We are all in this together. Being kind to each other will only make it easier for all of us to be the best for our patients. We know that even before the physical isolation of the last 2 years, many of you, physicians and staff alike, have felt somewhat disconnected from the CBO and administration at times. I really look forward to meeting many of you in person that I do not know yet and reaffirming those relationships with those of you who maybe we had more direct contact with in the past. I am committed to a renewed focus on connecting each site, each physician, every colleague in COPC to the common mission and vision of our great company. That is accomplished by doing a lot of listening to all of you over the upcoming months, as well as doing my best to make sure each of you understand the vital role you play in COPC. Together, we will lead COPC into the future and fulfill our promise to be the best for our patients, the best for each other, and the best for primary care. I am so excited to help lead us on this journey. Again, I'd like to thank Dr. Pugh and the Board of Directors, Dr. Wolf, and the entire administrative team, and my longtime partners at the hospital's practice for all of their support. Please reach out to me at any time with any questions or comments you may have. I look forward to speaking directly to all of you soon. We have a town hall planned for June 22nd, and I am sure I will see many of you in your offices in the months to come. Thank you.